Good afternoon, ladies and gentlemen. We are the team from the Hong Kong Polytechnic University. I'm the CEO, Linda. Our team consists of 6 members from different majors. We have Alisa, our CIO, Elliot, our CTO, and Vincent, our COO. Alicia is the product designer, and Ariel is the marketing manager. Since 2019, the COVID-19 pandemic has continuously affected people all over the world. Recently, the 5th wave pandemic caused by group infection has resulted in a sudden surge in COVID cases, leading to a shortage of manpower in hospitals. Medical staff, as well as patients, suffer from emotional collapse. Not only in hospitals, other places like elderly homes and quarantine centers, staff and patients may face similar problems, especially emotional issues such as loneliness and helplessness. Seeing this, our team started to think that what if we have a robot to help us solve these 3 levels of problems? Then, here comes our PolyCare, an integrated caregiver that can contribute to offering a fast response to future crises by monitoring public health to avoid group infection and supporting the speedy restoration of normal life by assisting staff in giving people physical and psychological health support. Poly in the name implies that it is developed by PolyU team and it has various unique designs for 3 levels of care: public, physical, and psychological. Now let's watch a video to see what PolyCare can do in detail.
The world has been severely affected by the COVID-19 pandemic. There are not enough frontline healthcare workers. Companies are facing the threat of a shortage of labor and the virus itself. Only a revolutionary invention can solve those issues. The Hong Kong Polytechnic University has invented the intelligent and autonomous personal care robot that could take care of patients' health, both physical and mental. Meet PolyCare, the smart robot.
There are some special designs in our PolyCare. The first design is a modular design. PolyCare has different modules with different functions, which can be combined together flexibly for specific purpose. Besides, our PolyCare will be covered by PolyU's special antivirus 3D printing material, which can kill up to 90% of the virus within 10 minutes. As introduced before, PolyCare should be versatile enough to carry out different tasks in different scenarios. So let's see how PolyCare can help in different scenarios. First is in the public area. While cruising and via an AI technology, PolyCare can detect people who didn't wear masks properly and warn people who violate social distancing. Besides, PolyCare will be equipped with thermal camera, which can obtain the people's body temperature and thus finding the potential fever patient in the public area. In this case, PolyCare can make the public area in a good order and safer. As a medical robot, PolyCare can also provide basic physical health support. First, PolyCare can obtain the basic health data from the patients, such as by measuring their body temperature and blood temperature regularly. Second, via the high-resolution screen, PolyCare can conduct telehealth with the physician remotely. And third, supported by Internet of Things, PolyCare can distribute the drugs prescribed by the physician automatically. In this case, only one physician can provide medical health services to a huge amount of people. This function will be extremely helpful, especially in a scenario where the patient-doctor ratio is very small, such as in a quarantine site. In addition to the physical health support, PolyCare can also provide psychological health support. While chatting with the patient, PolyCare will take real assessment of their emotional status, including their facial expressions and their voices. In this case, PolyCare will take action based on that. If the patient, for example, for the yellow alert, the patient may only have minor psychological issues, and PolyCare will such as play a game or tell a joke to help the patient. For red alert, PolyCare will consider the patient has severe psychological issues, and PolyCare will call psychological expert immediately to help the patient.
Now let me introduce our marketing strategy and business plan. Our potential market is very broad. Hospitals, student dormitories, kindergartens, all can be our application scenarios. We hope PolyCare can provide health protection in people's daily life. Compared with similar products in the market, PolyCare has the following features. First, PolyCare is multifunctional and highly practical, while most products in the market have only a single function. Besides, PolyCare has emotion detection and companionship. Most products cannot do that. Most importantly, PolyCare is a modular robot, so it can be applied to various scenarios and serve more people. So we did some market survey and received over 300 feedbacks. According to that, we designed some function package. Customers can choose the package or combine functions freely. And our pricing can also bring a significant profit. The estimated payback period is 3 years. We will officially release the products in the winter of 2024. Let's look forward to it together. COVID-19 is a challenge that people around the world need to face together. That's why PolyCare is here. We hope you can give us the opportunity so that PolyCare can help the human society to recover from COVID-19 as soon as possible. Finally, thanks for all PolyU staff who provide help for us.
Thank you. Thank you. Very nice.
I think you mentioned that your target customer segment is quite broad, but the problem is I feel I can understand initially deploy this in public space to do some monitoring, that's fine. But then in hospital, in care homes, a lot of the functions you mentioned, for me, it's like nice to have. Or there's already substitutes available. I think, for example, in hospital, how do you envisage your PolyCare will be integrated into the existing hospital workflow? Have you thought about that?
Hello, thank you for your question. I think you are saying about the drug dispensation or other services. Actually, our PolyCare is designed to solving the problem of shortage of medical personnel. And actually, we think that our PolyCare is a robot or buddy to help the problems of this shortage. And we can reduce the personnel that's handled in the elderly home. Of the PolyCare is not only about in the hospital. Actually, one of the points we may not point out in the PowerPoint is that we can offer it or set it in some distant places. Some places like cyclone, the car or the ambulance cannot arrive there within 1 hour or 45 hours or 45 minutes. And such a long time waiting in the ambulance. Our PolyCare, if there is a PolyCare in there, we can offer some drugs or some medical professional consultation to him or to her for the patient first.
I have to congratulate the team. Such an important idea of integrating everything together. Now, I also share with the medical experts on this side of the table that, yes, you want to come up with a multifunctional device. There may be variety in certain levels, surface, accuracy here or there. But when we group everything together into a product, whether a general customer would be able to afford it or otherwise, this will actually affect the business model. Is there anything in your PolyCare unit or robot that's better than the others? other than the 3D printing, what we call the COVID-19 thing, because there are a lot of what we call air treatment devices in the market, which may be much more handy, effective than what you come up with. So if they are trying to tackle different problems, they may try to just say solve 3 products and finish it.
Our solution is we provide different function package, and the customers maybe can choose the functions freely. Like in public area, maybe they only need facial mask detection and social distance detection, and they just booked the 2 functions. And the price is lower than the average. The 116,000 Hong Kong dollar annual renting is just average price. And if they choose less functions, the functions may be lower. And if they want something more high grade, like emotion detection, that may be more expensive.
Okay, we got it. Thank you. Thank you.